let's wrap up our discussion of the cardiovascular system by talking about some of the vital signs that you guys have learned to take, what normal ranges are, and some important aspects to the cardiovascular system. So our heart rate is how fast our heart is beating in a minute. So you guys have learned to count for the pulse. You count for 30 seconds, multiply it by 2. In some cases, you might need to count for the full 60 seconds. Normal is considered anywhere from 60 to 100 beats per minute. If it is below 60, the appropriate term is called bradycardia. If it is faster than 100 beats per minute, it's referred to tachycardia. It's important to note that throughout the day, our heart rate fluctuates. It fluctuates with what we're doing. If we're stressed out, if we're relaxed. It can also be altered depending on certain medications or even certain street drugs. If you are a professional athlete, your resting heart rate tends to be a little bit lower. It's not uncommon for professional athletes, especially professional cyclists, have low resting heart rates close to the 30s. And that's perfectly normal for those individuals because they've conditioned their heart to work more efficiently. If they were to stop their physical activity completely, over a period of time, their heart rate would probably gradually sneak back up into this normal range. So it's important to put this vital sign into the appropriate context when you're assessing it. And we're looking for specific signs and symptoms that, again, we're going to discuss much later when we have issues with our heart rates. Another vocabulary word that's important, because we have a little equation here, and I'll talk about the importance of this here in a minute. We have stroke volume, labeled SV. This is the amount of blood moved by one heartbeat. Cardiac output, or CO, is the amount of blood moved in 1 minute. So this leads us into this equation where we have heart rate times stroke volume equals our cardiac output. For class, you might have to do a small algebraic calculation, and that's perfectly fine. But the significance of this equation is when we are performing CPR. When you guys went through your BLS certification class, you were probably taught that we need to compress hard and fast, and we have specific rates in which we have to compress, and there are certain depths that we have to press down on the chest because we're artificially replacing that person's cardiac output. So the rate that is prescribed, depending on if it's an infant, child, or adult, it's all the same. That ensures this part of the equation. So the depth of the compression ensures we have the right amount of blood that is being moved out of the heart with each compression. So we can keep relatively close to normal cardiac output for this patient. Unfortunately, artificial compressions, either by mechanical means or by human means, it's not going to be the most efficient. So we're not going to be close to optimal cardiac output, but we can replace a significant portion of this cardiac output. And if we have deficiencies in how fast we're compressing or how deep we're compressing, we have negative effects on the cardiac output. All right. So that's the important take home of this equation, is why we do what we do when we are performing CPR. Now, on a minute-by-minute basis, our heart moves approximately 5 liters of blood each minute. That's a lot of blood. That's 5-liter bottles of soda. Our total blood volume is approximately 5 liters of blood. So every minute, our heart transports our entire blood volume throughout our entire body. And it all comes down to these components and this equation. So definitely get to know this particular equation if you happen to have some numbers thrown your way. Very simple numbers. Make sure you know how to apply that knowledge to this equation. Okay, so you have your heart rate. The units on that are beats per minute. Stroke volume is milliliters per beat, which results in our cardiac output, which turns into milliliters per minute. Now, you guys have also learned to measure blood pressure. And this is defined as the pressure that the blood exerts against the walls of the arteries. As I mentioned before, and in the previous video, there was the graphic that showed the changes in blood pressure between the type of blood vessel and the size of the blood vessel. So when you're listening for a blood pressure, you're listening to the pressure that's being exerted against the arteries. And we can break it into the two numbers. So we're going to go with the 120/80, the classic perfect blood pressure. That top number, or 120, is referred to as the systolic blood pressure, or systole. And this occurs when the left ventricle contracts. So you are measuring the force or the pressure exerted by that left ventricle when it is pumping blood out throughout the entire body. Then the diastolic, when we stop hearing the thuds against our stethoscope, that is our diastole. And this occurs when our left ventricle relaxes. That is the residual pressure in between each contraction of the heart. So when we're measuring the blood pressure, it's systolic over diastolic, measuring the high point and the low point of our contraction and relaxation of our heart. So that's important to know, because again, when we are talking about shock, measuring blood pressures, hypertensive emergencies, hypotensive emergencies. Understanding what we are listening to on the blood pressure is going to be key into understanding what might be going on with those patients. Then some characteristics of normal circulation in adults. It automatically adjusts and controls itself. So the nervous system is constantly monitoring the conditions of our body, and it adjusts the size of the blood vessels appropriately. It also controls the rate our heart is beating, again, just to compensate between being stressed, relaxing. We have perfusion, which is the circulation of blood in an organ that meets the needs of those cells. So when we start talking about shock, we use the term hypoperfusion. And this is when we do not meet the cell's demands for oxygen and nutrients. Blood enters organs and tissues through arteries, then blood leaves organs and tissues through the veins. All right. So again, a big thing to remember, in a general sense, arteries carry away from the heart. Veins are going to carry toward the heart. With that, that is the overview of our circulatory system. Keep on top of your textbook. Get to know your drop of blood. There's a worksheet in your blue books, and you also have an online assignment pertaining to that. Remember, think about which part of circulation we're in, pulmonary versus systemic, and how that changes whether the blood is oxygenated or deoxygenated in our arteries and veins.